Welcome, everyone. My name is Jen Sharon, NHIA's Chief Operating Officer and your moderator for today's second session in our COVID series, Staff Onboarding During COVID-19. I would like to take a moment to thank our generous sponsor of this series, McKesson, an NHIA Future of Infusion Advisory Council member, as well as NHIA Gold member. We have Mike from McKesson here today with us to say a few words. Mike?
Thanks, Jen, and good morning or good afternoon to everybody. It's wonderful to be with you. For those I don't know, I'm Vice President of Home Infusion Sales at McKesson, and we are certainly excited and appreciative of the opportunity to sponsor today's piece on staff onboarding during the age of COVID-19. Most certainly a relevant topic. We've always had a prominent role, obviously, in the supply chain and healthcare industry, but that's evolved very, very rapidly. Whether it's needs around ventilators or PPE or now hopefully soon to be vaccines, but also the way in which we work has evolved very rapidly, keeping our delivery drivers and all of you safe, keeping our team safe, working virtually and adapting to that. So in addition to being excited to sponsor, I'm excited to hear Judy's words and likely take some notes myself. So many thanks for the opportunity, Jen and Judy. It's great to be here with you. So looking forward to today and good to see everyone. So with that, Jen, I'll get it back to you.
Perfect. We truly appreciate McKesson's support for the home infusion industry and the entire COVID-19 series. Building off the NHIA Summer Series success, the NHIA education team created a star-studded lineup of COVID-related education to be held each Thursday from 12 to 1 Eastern Time for the month of October. Make sure to watch Infusion Express for upcoming sessions and registration links, or visit NHIA's new website, click on Learn CE Education COVID Series to register for future events or catch up on education you missed. Just a couple of housekeeping reminders. The presentation is available for download from the handout section of the navigation pane, as well as speaker bio. The webinar will be recorded. A link to the recording will be emailed to you following the conclusion of the webinar and will also be available via NHIA's website within the next 24 hours. In order to receive CE, please follow the link in the follow-up email and answer a short quiz. Following the presentation, we will have time to answer your questions. Please submit your questions via the question tab in the navigation pane at any time during the presentation. In addition, today we'll be using the chat feature to share ideas and thoughts about virtual education. The chat box is found in the navigation pane below the question tab. Please share your thoughts and ideas with each other throughout the program. Okay, now on to our presentation. Joining us today to share her expertise is Judy Maggi from a national manager for nurse education at Quorum. She has been with Quorum for over 4 years. Judy is responsible for strategic planning and implementation of nurse education for leaders and clinical staff throughout the country. Judy, I know we have a lot of great information today, so let's get started.
Hey, thank you, Jen. Before I start my presentation, I just want to let you know I have no financial relationships to disclose, and I will not be discussing off-label use of or investigational medications or therapies in my presentation. So I just wanted to kind of share that with you. So let us begin. I wanted to begin with a quote. And I think all of us as educators can relate to this, because when we design programs for our staff and our colleagues and our leaders, we want to make sure that what we are producing is actually going to be used back on the job. And Tim Sanders is a New York Times bestseller. He was a former executive at Yahoo. And I just thought this quote really set the tone in terms of what we do as educators and leaders, and really the need to be impactful and to make a difference in those that we're providing our services to. But I just start with that. So how did we get here? Okay. How did we get here? As you know, COVID has totally absorbed all of us as of mid-March. It has created a lot of challenges and changes in our life. And you know, when I think about it, I think about, oh my gosh, I never could have imagined little kids walking around with a mask on their faces. I could never imagine not going to my favorite restaurants and going to see concerts and things like that, the limitations in our freedoms. I didn't even have a chance to see the birth of my grandchild in September. But I'd like to think about it as, COVID has really created some unique opportunities and solutions, and creativity has come out in so many different ways. If you think about it, all this curbside service so that we can access the great food that we enjoy from our restaurants, and about, drive-by birthdays. Not the best, but, our children have some kind of semblance to, normalcy. And then, I just think about, they have drive-in concerts now so that we still have access to the music that we love. So I want you to use your chat box now, okay? And I want you to think about what were some of the most creative ideas, either in your organization or, what you've heard in your community that have been implemented subsequent to COVID-19 and the lockdown. So I'm going to give you some time to put it in the chat box. It doesn't have to be earth-shattering, but whatever, maybe in your organization or in the community.
All right, Judy, I'm just asking people to put in their chat here. We'll wait a couple minutes, or we might be able to go back to it, Judy, if you want to move on to the rest of your presentation, and I can let you know as things come in.
Okay. Great, Jen. Thank you. So that brings us to my story and why I'm here with you.
Judy, it is hard. It's a little bit hard to hear you.
It was basically in a decentralized organization. And I have a feeling, I gotta share this, I'm gonna keep things real with you. One of my earpods just fell out of my ear, so I need to bend down.
Okay.
I'm gonna bend down and pick it up. And back. Thank you. All right. So I'm feeling like I could hear something on the floor, and I'm like, all right, we're better now. We're back. Okay. So that brings us to the presentation and the objectives. All right. Back in mid-March, I was a decentralized department. It was me, and I worked with various nurse managers and preceptors for the actual implementation of a nurse's orientation to the home infusion role. So what I did was create a lot of tools. I created orientation checklists, trainings, things like that, but that basically implemented by the branches. And obviously, COVID-19 hits. We need to hire essential personnel, right? And therefore, I needed to figure out how we were going to do orientation, because everybody was being sent home. People were not being permitted in the branch. We call our offices branches. And therefore, it was going to be very difficult to orient new nurses. So that's how, within 2 weeks, because this is mid-March, then in April, I was asked to have it up and running. And we put together, I worked with my subject matter experts, the corporate nursing team, to put together initially it was 7 sessions to start that orientation of new nurses. And then it's grown from there, which I will definitely share with you. So for today, what I am hoping to achieve is that you are, through the exploration of the virtual training strategy and discussion of challenges that you're going to face when you're implementing virtual training, and looking at key performance indicators and evaluation methods and best practices, that you will not be entertained, hopefully a little bit, but that you are going to walk away with ideas and information and possible tools that you can leverage back in your organization. And again, I would really value making it a two-way process that we can share and learn from each other. Because as educators, we always gain something through our interaction with the learner. So let's start with a polling question. And so before COVID-19, again, if you looked at in your organization what you're doing, and you looked at your e-learning, your instructor-led learning, your self-learning modules, and virtual learning. So look at training in totality in your organization. What would be the percentage that was virtual, like a webinar, like we're doing right now?
All right, the votes are coming in quick, and actually, while we're waiting for people to vote, I have a couple of things that people brought up about some great things that have happened. Telemed nursing visits was one of the ideas, innovative ideas that's happening. Continuing simulation with remote facilitating, creating remote simulation for nursing schools. Wow, that's fantastic. We need nursing schools to do home infusion. And e-visit implementation. So there's a couple of ideas that kind of came in from the group. Let's see now. I'm going to close the poll and let's see what we have for results. Looks like, Judy, 61% said less than 10% of their education was virtual. And then it kind of goes about 10 or 11% from there, and between 50 and 70% is about 17. So the majority of people did not have a lot of virtual training.
And that is not unusual. And that's not unusual. In a, it's an infographic by Learning Solutions. Excuse me, I need to go back in my, sorry, I jumped. So in an article by e-learning industry, it was reported in 2017, 77% of the United States companies used online virtual learning. In 2019, that was reported by Cindy Huguet of Learning Solutions. She reported that 93% of all organizations were using some online or live learning. But what the ironic piece of this was that most of those organizations, though they were using it, 77%, then 93%, only 10% was virtual. Okay, so it's just not healthcare. I think, I think this information, kind of shows that creating effective virtual training was not a real priority in most organizations, and that it's something that can be quite challenging. But the thing that I'm really interested about is looking at what will 2020 show in terms of the percentage of virtual training as compared to all training that is done in an organization. I think it'll still be 93% or even higher that organizations are using it, but in terms of how much of that is virtual and synchronous. Synchronous means happening, right in the moment. So I just thought that's pretty interesting. Some facts. Again, development time. As you know, to do instructor-led training, it's a little bit faster than doing computer-based training or self-learning modules. And for virtual training, what the research showed was that it takes 21 hours of design time to create 1 hour of virtual training. I was really surprised by that. I thought it would be a lot longer, but again, the impact or the development time really is contingent upon how complicated the information is and the level of engagement and things like that. But usually it's about 1 hour of virtual, it's 21 hours of development time. 66% of respondents indicated that usually training is 90 minutes or less. So that is basically a benchmark. Can you imagine, and I think some of us can who have children who are doing virtual education right now, sitting in front of a computer for more than 90 minutes? It is really challenging, first of all, to keep people engaged, and second, for people to pay attention to, being, on a screen for such a long time. 81% will have a class size of 25 or less. And again, the more people that you have, the more difficult it is to engage them. So if you can imagine 100 people trying to do polling questions and chat boxes and annotations, things like that, it can get a little bit challenging getting all that information, but it can be done. So trust me, it can be done. And the most popular platforms that were identified were Adobe Connect and Cisco WebEx Meeting and Training. So they're the platforms that most organizations are using. So did you know that in 2019, we spent about $18.66 billion on educational technology, but it's projected that we're going to spend $350 million in 2025. And when you look at 2000, okay, So 20 years ago until right now, 2020, e-learning industry has grown over 900%. I just find that astounding, and two, very interesting. And so I was just amazed, and you can see how quickly things are moving in this realm. So another polling question for you. When virtual training was compared to classroom training, so instructor-led training, which modality do you think was found to be more effective? Do you think it was virtual training? Do you think it was classroom training? Or do you think they were equal? So put your, go to the chat box and select your response.
Excellent. So this is great use of interaction programming, Judy. We have, people are really jumping right on the voting here. Going to give another minute or two. I was so surprised on that increase in numbers and the growth, but then again, so many things are virtual now. Look at, I mean, I got my master's degree virtually, never set foot in a classroom. So, and everything's changing for sure. All right, let's see what people said here. All right, so 42, it's split right down the middle. 42% believe classroom or both are equal, and then we had 17% choose virtual.
Okay, excellent. Again, I was surprised by this, and again, technology, because every time I think something happens moving on the screen, it takes me out of my slideshow. Okay, so I just want to let you know, you can see how interesting technology. This is like the bane. Okay, but in an article written by David Maxfield, Director of Research and a Senior Consultant for Vital Smart, he published an article in a 2016 issue of Training, and basically here's what they found. It was both were equal, and when designed carefully, according to the article, and conscientiously, virtual training can provide the same results as instructor-led. Now, if you think about instructor-led, you have that. You can see the whites of their eyes. You can see what people are doing and if they're engaged, if they're not, and you can kind of make adjustments. But if your design is really well in the virtual training realm, you can engage and keep people with you so they are learning. In terms of specific information, 86% of the virtual classroom participants rated their experience in the virtual training just as engaging or more engaging than traditional classroom. So it can be done. 100% of the participants who were highly satisfied with their training experience. And when you looked at mastery of the content, there was only a 1% difference between virtual training and instructor-led. So, where we think the gold standard is instructor-led training, COVID is teaching us that virtual training can be equally as effective, which is good. So let's look at some specifics related to virtual training design, okay? So as training professionals, I really don't want to walk you through the ADDIE process. You all know the ADDIE process. What I want to do is take specific pieces of that ADDIE process and what is underneath it and go into a little bit more depth. So I'm looking at content identification, technology, program design, and communication. So let's start with content design. Before you identify any kind of content, we all know we want to identify what are the goals of the training. What are we doing this for? What is it, the outcomes we're trying to achieve? What does that learner really need to learn in this program? So you really want to start with that. So how do we get that information? We're going to do a learning needs assessment. That's good, and we're going to work with our leaders in terms of their organizational priorities and what are the performance priorities for that group of learners. Now, I told you that I started in mid-March, and I had to have it up and running in April. And so our traditional ways of doing learning needs assessments, like sending out a survey and giving them a list of topics and asking them to rate them, having focus groups, meeting with people, things like that. In 2 weeks, I really didn't have a lot of time to do all of that. So what I relied on is when I had been working with the nurse managers, the senior leaders, with staff, and creating tools that they were using, I also saw what were the pain points for them, and what's really important for that new primary nurse case manager, that new field nurse coming in to learn. I worked with the corporate nursing team and SMEs to get that information. And you know what? I said to myself, I got to do this. Is it going to be perfect? No. But I always knew that we're going to constantly be revising and updating. But this was something that was truly needed and was going to fill a void in terms of what the immediate need was precipitated by COVID. So that's number one. I was constantly getting feedback and support. Feedback, meaning I implemented, got feedback from participants through level 1 evals. I talked to nurse managers. By communicating with those stakeholders, whether it's a staff nurse, nurse manager, senior leader, corporate nursing team, national director of nursing, what happens is I'm getting important information that will help make this program even better. And number two is I'm garnering their support. They're going to buy into it. They're going to see the value, and I'm going to communicate all of that to them. Then I also engaged my SMEs because I was not able to put all of that information, that program, and those PowerPoints together solely by myself. I needed my SMEs who definitely knew those topics, were experts in it, to help me to actually get this up and running. Technology. Wow, I could do, I think, a program on technology, a whole hour on that topic itself. So technology, it is really important that you identify your platform. What is it that you're using? And then you need to really know how to use it. Because even though you could be the expert, and I used to say I'm the WebEx queen because I really thought I knew WebEx. There's always something that will trip you up. So you really want to know the platform. Is it accessible to your learners? Okay, that's really important. We got tripped on that one because some of our learners did not have the knowledge on how to get into WebEx and to navigate it. So we learned that, but it's important in terms of if they were using their iPad, could they access WebEx on an iPad versus a laptop and things like that. You want to assess in terms of assessing the knowledge, the technology to be used, you want to look at its functionality. Do you know how to use it? For me, WebEx, it was annotation, whiteboards, chat features, polling, and do the presenters that are working with me know how to use that? And do the participants who are coming into the room, again, do they know how to do any of that functionality? If you think about our typical infusion nurse, many of them are not real tech savvy, and that's okay. And many of them have not used WebEx. They've not had to use that. So we really needed to support that, and that was another thing that kind of tripped us up a little bit. So looking at training needs for your staff, for your facilitators, and then anticipate what your needs are, what are issues that are going to come up, and see if you can reach out to preemptively address those. But I'm going to tell you, there are going to be things that come up that you never even see coming. And that's okay, because you'll figure it out on the fly. We always do. Next is program development. So here's really where the rubber meets the road. And what I mean by that is we've identified the goals and the performance that we want to see. So now we are looking at the content and the creation of each of those sessions or those topics for your program. What we wanted to do is, and with instructor-led training, you feel like you can just keep on talking, and you're going to see people, and you're going to know when they're kind of fading and things like that, and call break or change it up. But in the virtual world, it's a little bit more difficult. So you really want to look at all the things that you've identified, the content that you want to cover, and really figure out what really needs to be covered during that virtual time, because it's going to be very hard to cover 4 hours of instructor-led training in that 90 minutes. So now what you want to do is look at a different way for that material that you're not going to put into your virtual program. How will you get that information across? Are you going to do some pre-work? Can you do a video and they can watch a video? Do you want to do a self-learning module? Is there something that can be done post-training that they can get that information? But you really want to be very, very specific, very focused on what content you cover in that virtual training so that it does support what you need. You want to make sure that you have session objectives. So you want to be clear to your learner, this is what we're expecting you to learn. And you want to make sure that you have ways of measuring that, not only at the very end of the program via summative evaluation. So that's looking at all the learning they have and what have they actually remember, their cognitive ability to recall it all, and then also apply it, but formative. Informative evaluation is as you're going through the training, what are you seeing? Are they picking the information up, the education up? And we're going to talk about how that can happen. What are your assessment techniques? So how are you going to measure the learning? Is it via, gaming at the end of the session? Is it going to be through multiple choice questions or a mini quiz at the end? There's so many different ways that you can really see where your learner is at. When I do like overview of the primary nurse case management role, what does that mean? What are all the orientation resources we have available? But the way that I kind of get a sense of where my learners are at, not only by using, we do polling, or I should say, I do polling in that presentation. I do some chat box. But at the very end, I say, what is the one thing that you are going to be taking away from this presentation and using back on your job? And most times, I look for a majority of people to respond. Not everybody responds, but I really do look for a majority of people to tell me it's one thing, and what are you going to take back home and really use. And then in the content development process, getting feedback, showing it to your stakeholders, maybe a subset of your stakeholders, to say, hey, this is what we're planning. This is the agenda. Is there anything that we're missing? Is there anything that we need to be including? And then again, that constant quality improvement process, going back, assessing, reevaluating, and then revising. In terms of, you think of real estate, you think of location, location, location. But in the virtual training world, it's about communication, communication, communication. You want to keep people with you. You want them to be engaged. You want them to support what you're doing. So you need to constantly to communicate and then get their information. Okay, so I'm going to give you an example. When we started the process, I brought nurse managers together, especially those that were sending people to our orientation, and I went through it all. I told them what they can expect, what I need from them, what were the materials, how do you register, where are all the training materials housed so that they can access them. Because initially we had asked them to pull them down and send it to the participant. Okay. We found out later that was not working. And I'm going to talk about things that, where our challenges were. But the bottom line is we communicated. I communicated through email. I went to the nurse manager meeting and shared with them what, again, when were the next sessions? How do you register? Because we definitely changed that process through the feedback we were receiving. What great changes or have been happening behind the scenes that will really help them and their staff. So it's constant communication, show the value. So let's take a break. I'm going to ask you another polling question. So you heard a little bit about that, the design, the development, communication, technology. What I want to do is, what do you see as your biggest challenge in designing virtual training? So is it converting an instructor-led program into a virtual training, creating ways to make it interactive, implementing effective ways to evaluate it because it's the whole new modality, connecting from the virtual training world to the learner's job? Or is there something else that, you feel will be a big challenge for you as you go to venture into the virtual training world or continue your development into that virtual training world?
All right, we got almost 50% people have voted, so we'll just give them another minute. You're sharing some great information, Judy. I love how you're bringing in your lessons learned from your group as well, because it's never perfect, and so we just want to keep changing and improving along the way. So here we go. Let me see what people said. All right, so 36% said creating ways to make it interactive. The other 27, the next highest is connecting to the virtual trainer to the learner's job. Then we have 21% about converting the instructor-led program to a virtual training. And we didn't have anybody who put in anything other. So kind of spread out on that one.
And I'm not surprised because this group can be, it could be very mixed. There may be people who have a lot of experience in that. Maybe I should have asked that question. What is your experience with doing virtual training? But, again, the gamut's there, but I'm not surprised by your responses, and I appreciate you sharing those. Because I find basically all of these, and these are things that we had to adjust as we went forward in creating a virtual synchronous training program for orientation. So let's look at converting and creating virtual learning. Okay, so converting your awesome instructor-led training. Oh, it's the best program, and I've had those programs where people were really engaged. They were loving it, and they were having fun, and I saw their faces. And now I got to take it and do it differently and make it an virtual training where I'm not going to get all that energy and feedback. So, for me, that was very challenging and very heartbreaking because I enjoy, seeing people and talking with them. So what, I was really challenged with was how do I take that content, make it interactive, make it high energy, make it fun in a virtual way. And so it really does push your creativity and your, speed in terms of execution. So in terms of converting, and again, what the literature is supporting is analyze your content. We talked about this, an instructor-led training and converting it to a virtual training is not one-for-one content. You don't take 4 hours and just pick up the slides and move it right on over to your virtual training platform. That's not going to work. It's going to be very difficult for people to really walk away learning what they needed to learn. There we go. Okay. Make sure that your platform is accessible to everyone. I don't know why this is doing it. I find this very interesting because I'm not even touching my mouse. I'm just leaving. You see my hands. So, okay. Platform is accessible to everyone because, you want people to be able to enjoy the learning, not fight with the technology. And that is really frustrating for learners when they have to fight and they can't engage and they can't use the tools and things like that. Chunk the content, really important, and that's going to help you to, again, figure out what is it that you want to present virtually, and is there another way to share that information? Is it through an FAQ? Is it through pre-learning? Is it through job aids, self-learning modules, things like that? What I've learned is to keep the connection between the various topics, to do maybe a short review at the end of a topic and maybe a short review at the beginning of the next day's topic. And you could do that, and it's a formative evaluation methodology. Maybe have a polling question asking them something that's important that they should have picked up on and have them answer the polling question. If they get it 100% right, that's a really good news story because obviously they've heard what you said and they're learning it. Materials are simple. As creative as you could possibly be, you want to be with your materials and your PowerPoints, because remember, they're orienting. Some of them are coming with no infusion experience at all. When I came to Quorum, I did not do infusion nursing, but I was learning very quickly how to do it. And so you have people, that whole gamut of novice to expert and coming to your orientation. And that is also a challenge. So you want to make sure that your learning materials are easy to follow and understand. Okay. The delivery and engaging methods. You don't want to just chat box, or pulling. You want to, kind of mix it up a little bit. And as I talked about, oh no, I didn't talk about it, but it's coming on the next slide, about how often should you start mixing it up. And then it's the continual improvement. Still doing it now, constantly trying to figure a better way to do the training and make it effective and useful and applicable. So, in the chat box now, what I want you to do is I want to know what you think the advantages and challenges are of virtual training over traditional classroom training. So what do you think, virtual training brings its, a strength, and what are things that are, make it more difficult than instructor-led? We're going to put that in the chat box.
We'll have, it took people a little bit to get those answers in. So if you want to move forward, I'm happy to, at the next kind of break in your slides, we can go over what people have put in. Oh, wait a minute,
Okay.
Judy, oh boy, people are much more on the ball this time here. All right, so some advantages are no travel. Some challenges are keeping everyone engaged. Let's see. All right, and another advantage is being able to serve a larger population at the same time. That's a great one. More flexibility for learners. Consistent training from person to person. I know you talked a little bit about that. Another advantage is decreasing cost. Maybe it's less expensive. Expenses of having to possibly travel to a live classroom. One of the challenges is technology, which we are experiencing today, and we live it every day. Yep. Oh, we get some great ones. Another challenge is having people not multitask while they're doing virtually. When we figure that out, we're going to incorporate that as well here. Let's say decreased costs with travel, easier to get groups together. Another disadvantage is trying to keep the learner engaged. Yeah, I think that's one of the big ones. Boy, lots of great ideas, and that's what we have. Perfect.
Absolutely. And when you were asking me to go to the slide, you'll see why I really didn't want to jump to that slide too quickly, because I think they all saw my slide before I even am showing it. You can see, this is the beauty of, this level, of engagement and hearing from you. You hit them all, basically. The advantages, that reduced cost, reduced travel time, not paying for a conference room. It does increase accessibility. Instead of having limited to 10 people in that conference room, you can have people from all over the country come to your course. And by increasing that accessibility to training, that will hopefully engage our employees into the organization, because we care enough to be offering training and giving them an opportunity for development. You can, as I said, bring people from multiple sites in, and you can have one consistent trainer or two consistent trainers. That's what we do. We cross-train our educators, and so that, there's some coverage, but there's a consistency there also. That's really important, as opposed to if I need to go throughout the country and I have to have 5 different people communicating the information, we may all say it a little bit differently. And it is, as we heard, it's as effective as instructor-led training. It can be as effective as ILT. Disadvantages are unprepared participants. They get this information and they're like, oh, nobody's going to check it anyway, so I don't have to worry about it. Technology challenges, limited participant engagement. You guys brought that out. Unskilled facilitators. You do not want somebody doing virtual training when they really, really don't know how to do it. It's not good. And it really turns your learner off if you think about it. Non-interactive program design, challenges with skill development. You're right. There are some things that are really easy where you say, here, I'm going to give you the ball. Show me how you're going to document on our clinical. I'll bring up that clinical form. You show me how you're going to document that patient visit from this scenario. There's other things like show me how you're going to insert an IV. Now, You can simulate that, right? We can do that. There are simulations. Right now, I don't have simulations available to me, but as I heard, some of you do have some simulations that can be used, and they are being used in nursing programs. But there are times when, connecting the skill practice into a virtual can be a little bit challenging. Management of distractions, oh goodness. You're right, Jen. If we solve that problem, wow, we could market that. Volume of screen time. Sometimes people like to just put it all in one day. Just get them in the room, get it all done, and I'm sure after 8 hours of looking at the screen, they were going to know it. That is not true. And then multiple time zones. I do provide training to East, West, Mid, Mountain, the whole 9 yards, Central. And so when we implemented the virtual orientation program, we started at 11 a.m. Eastern so that people on the Pacific side of the world or the West Coast are able to attend, and they're attending at 8 o'clock. So that can be a little bit tricky. All right, design. Okay, let's talk about best design of virtual training and its implementation. Again, I know I've talked about this a lot, creating learning exercises. And when you look on implementation, look at the second bullet point where it says that the interactive design, you want to engage that learner every 4 minutes. Now, obviously, I have not done that all that well for you, especially in this back end of the program. But every time you put an exercise out there, it doesn't have to be a case study. It could be an opinion question, and you can, call on people and you let them know you're going to call on them. But it's not something that they have to have it. It's a fact and they have to, talk about it and know it. But an opinion question engages people and having them annotate or put in the chat box. You want to use the tools. Polling, gaming, breakout sessions are really great. And we have a breakout session depending on the complexity of what you're breaking them out and having them discuss. You may want to have somebody in that room who can help facilitate, or you can, explain to them how to facilitate and let them go. Blended learning approach. Okay. So the traditional definition of a blended learning approach is some FaceTime and some virtual. And so in an article by Johan Kronig called Towards a Definition of Blended Learning, he's asking to make it a more robust definition. So not only about FaceTime and virtual training, but he's looking at asynchronous training, incorporating that, looking at incorporating a learning theory into that process, and then how do you marry this with actually learning by doing? So instead of just FaceTime and ILT, let's look at putting all of those pieces together and making it a more robust process and making it more effective, especially for virtual. Spaced learning is, again, not having 8 hours of virtual training on one day, but looking at breaking it up. Now, for when you have staff who are being measured by productivity standards, that can be tough. So again, you want to get that feedback and support from your leaders. For orientation, for at least for us, 6 weeks or so, most of our staff are not, quote, 100% productive because they are learning and they're going out on shared visits and in a skills lab. So that may not be an issue for orientation, but if you're going to do other programs, and I'm going to talk about that, you may want to really look at partnering with your nursing leaders to figure out what's the best spaced learning. Do icebreakers. It really is worth the time. It's a way to connect people. It is a way for to review or reinforce learning, things like that, and also to help them prepare for the next day. That's recapping, beginning and an end. Clear expectations. Really important again. Hopefully that will help with minimizing the distractions and people doing their wash and maybe cooking some dinner, things like that. One thing we really, really stressed and made mandatory was when you're going through the virtual orientation, you are not on visits. That is unacceptable to be doing a patient visit and trying to be listening to training. Second thing is you're not driving. And believe me, I don't even want to tell you, there were people who were, kind of thought, oh, it would be okay. No, this is work and this is important for you to be totally 100% focused. We want to, engaging facilitators, meaning I don't want somebody who's going to be reading the slide and say, this is really important. No, I want somebody with some energy, one wants to have fun. They're not perfect. And that really knows how to use the technology. And I want prepared participants. I'm going to set that expectation. And the way I'm going to get them, to realize this is important is that pre-work is going to be integrated either as, before we start the training or integrated in the training. Somewhere, somehow, it's going to be integrated so that when I call on them, they're going to know, oh, I said this, and I'll preface that, this is a question from your pre-work, and then boom, and see how they do. Because once you kind of get caught a little bit, then you realize I better be doing my pre-work. So now here's what we did. Okay, so we did a blending approach. We had pre-work, we had post-work, we had all the tools to engage our learners and case studies, things like that. We did not make a training session or content session more than 90 minutes, because we did go over that initially, and we had 2 hours, and people were like, woo! And a 5-minute break between both hours, it really doesn't cut it. Okay, we varied our presenters, so it wasn't just the training team. We also had subject matter experts that came in and did the presentation, so it kind of broke it up a little bit. We had case studies that we applied. We used WebEx interactive tools. We revisions, creation of tools. We did a lot of like job aids and tools really help people to feel like they were getting the information. And we explained why it was important for them to access the tools and why it was important for them to do the pre-work. Constant communication with nurse managers. They're going to be your biggest supporters. They're going to just love you because you're helping them. And it's making it a little bit easier to manage that new person coming on board, because we don't want to lose them. It costs a lot of money to onboard new people. It impacts more more oh my gosh, I just like, not more morality. What's the Jen, help me out. It's like the energy, oh my
Employee
goodness,
morale.
I'm having a blonde. Thank you. That was it. Employee morale. It really does, because you're like, oh my God, another person's left and I got to take their work on, things like that. And we all know that. We recorded all our sessions. And the reason was, one, if a person missed the session and they needed to get that information. Two, what if you have an incumbent staff member that kind of didn't get it, and it would be really helpful for them to have a refresher on that content, and also for us to hear it and to see, where did we kind of need to kind of do things a little bit differently. And then a little thing, you want to connect with your participants, and you want your participants to connect with you. So an idea that we did and we implemented was, we asked participants to send a couple pictures of themselves or their family or whoever they wanted, and where they were from. And so before each session, we would have 2 or 3 participants introduce themselves. And what we did was we role modeled it for them. So I'm going to show you what I did. So here's my slide. Okay. So I was born and raised in Philadelphia. Now I live outside of Philly a little bit. And so of course I have to have Rocky. Oh my gosh. It's synonymous, Philly and Rocky and cheesesteak. So then you see pictures of my family, and then as I went through them, I talked about my daughter and my passion for helping people with children with special needs and parents to help identify and get resources for their children to help support their learning. So that was an example of my introductory slide. So I didn't go through my resume with them. I really just talked about my love of education and training and things that are important to me. So it was really cool. And people really did it. I was so excited. I loved hearing about them. And then we got to see them, because let me go back for 1 second. And one thing that was our approach. It needs to be on both the best practices for virtual and our approaches. We had our cameras on, and we asked our participants to put their cameras on. So here's again that technology glitch. If they were using their iPad, it was really difficult to figure out how to put the camera on using your iPad, and they were really struggling. And the other thing is, many of them were not set up, because we did that with them during training. Okay, then we asked them to use their home computers to log on to WebEx. a lot of their computers did not have an integrated camera. So they couldn't see each other, but they could see us. And we made it mandatory that the presenters would have their cameras on and have a good hair day. So here's our problem. So I'm going to put our dirty laundry out there, okay? We had IT issues. IT meaning, how do you get them up and running? How do you make sure the things that needed to be loaded on it were loaded, things like that, okay? So our answer to this was, we're now the IT support organization for our nurses and nurse managers. We do not want to be in that business. It takes a ton of time. But in order to really help support those new people coming on board, taking away a frustration for them to help them to be more successful, we took it on. But we are working with our IT buddies to resolve that issue. WebEx, what we did with that is, I don't do an introduction to WebEx day one. I've recorded myself, showed them all the functionalities, and we send it to them before they ever come to training. And the last training we had, I said, how many of you actually, looked at the video? And many of them had, and they were able to get into the WebEx, use the chat, use the polling, all those great things, unmute themselves, mute themselves, get out of the training, things like that. Receipt of materials. We had originally asked our nurse managers to send it to them, the agenda and expectations, and here's your learning materials and orientation. It wasn't happening. It's hard. It's really, they're very, very busy, as I'm sure your leaders are. And so we took that on. We wanted to make sure that they had the pre-work, they had the materials, the agenda. So before they come to training, they receive all that information. And then each day, the day before their next training, they have all their pre-work and PowerPoints and things like that. Need for training stat. Well, I had 2 weeks. The bottom line is you say, I'm going to do the very best I can, make it happen, and know that it's not going to be perfect, and I'm going to change it. I'm going to make it better and better and better. And then I have an even greater story to share with leaders and nurse managers and anybody who wants to hear me talk. New colleagues without equipment. And they were coming to training, and we were expecting them to use some of that equipment. So they were looking at a presentation on screen, and then they had their iPad to pull up clinical documentation forms so that they could practice and look at them and complete things. Okay. They didn't have their iPad. There were some delays in terms of back orders and not getting them from the vendor and all that good stuff. So what we do now, and this is going to be one of our best practices, is that the employee, the new hire, does not attend the virtual orientation the first day they're onboarded. They come into the organization. It's too hard. We're asking them to come in a week before, be with the nurse manager for maybe a day or two, because remember, we don't want everybody in the branch. Everybody's home. But during that time, we're identifying things that the nurse manager, the preceptor, and the new employee can do for that week. Because, you're sitting there, they can't come in. What am I going to do with this new person? They're just going to be sitting at home. And it takes a little while for our nurses or new employees to come in and get access to our learning management system where we have e-learning. So that's another, challenge on top of that. So basically, we have them come in a week early, work with the nurses, go through a document that we put together to help the nurse manager figure out what to do for that first week. And then they will go out on supervised visits where they are observing, but they're contacting the patient to make sure it's okay with that. Technology skills of learners. Again, handouts, videos, just to help them to learn. And when they give us a call, we help them through it. Skills lab, we will always do a skills lab. They'll come into the branch, PPE, and they get to practice, learn the equipment, use the equipment. But we make sure that they have read the policy, read the competency, and if there's a LearnNet on it, they've done the training. So they walk in, I tell them, come in with questions. Practice as much as you need to, and then go out on a supervised visit. And it's not only about completing the competency or the skills checklist, but also it's in the context of a therapy. I want you to know the whole therapy, and then in administering an antibiotic, you need to know about a PICC line and how to do a central line dressing change and aspirate blood and whatever it may be. It's not about, oh, I've got this one competency signed off. Oh, that's great. Oh, now you can go on a visit. No, it's about really learning the therapies. And then we mandated, and we got the support of the National Director of Nursing, it was amazing, to mandate that nurse managers need to meet weekly with their new employee. And I'm not saying coming into the branch, via FaceTime, via a conference call. But the bottom line, each week, the nurse manager is talking to that new person, in, showing that they're totally invested in them, that they're hearing what's going well and what are the challenges that are being faced, and how can the nurse manager help them in their orientation. Goals, very quickly. Our goals were, we wanted to improve colleague retention, nursing retention. We didn't want it to be a revolving door because, we weren't providing what they needed. We wanted to help them learn the role faster because we thought we have a consistent curriculum, so that's going to help them to learn it as opposed to being piecemeal. Increase the knowledge about home infusion, so they're not leaving because they're saying, oh, this is not the job I thought it was going to be. And then doing skills and competencies and having the knowledge to do those consistently. Retention, I asked HR to give me information from second quarter 2019. What was the retention rate? How many people did we hire? And then what was the information for 2020? 2020, we hired more people in quarters in April, May, and June, and we increased our retention by 3.5. Not that I'm saying it's all us, but the difference was one had a program. Oh, wrong one. 2019, one did not have a program, and 2020, we had the virtual orientation program. And as you can see, nurse managers felt that 50% of the nurses coming out of class could learn their role a little bit faster and more effectively, and 75% that we increased the knowledge and they were able to perform skills labs. So obviously 50%, we have a little bit of work to do. I mean, I would love to see 100% of people saying 100%. How do we measure it? You guys are probably equally as adept in doing it. All of these communication, level 1 evaluations. We are in the process of evaluating staff 3 months after attending and getting their feedback, and also asking the nurse managers what they're seeing 3 months after their staff have attended the programs. I asked HR for retention stats, and just by word of mouth. What did our participants say? I thought this was, I really was excited about this one. And you wouldn't expect it on this kind of eval. This is the 3-month eval. I asked them, where do they see themselves in the next year? Are they going to stay with Quorum? They're like in the process of looking for a job, or they've like kind of really, they have almost like have their resignation in hand. 93% said they were planning to stay. And that's pretty exciting. All right, back on the job application. 65% said they could do it at a fully competent level. I'm a little bit like, that's interesting. 30% were able to do it. They were able to do job tests, but need a little bit of help, which I would believe, because again, everybody's coming from a different experience level. 58% said they were able to apply 60 to 100% of the training back on the job. Again, we have an opportunity here to maybe do a little bit differently and get that number up. Our nurse managers said that all of them who responded to the survey said that they felt this was very effective and would recommend this program. And that one of them wrote that they thought it was well organized. They love the shared team sites because that's where we have them going, and the communication. Our opportunities, more interactivity. We need to do a preceptor program, because I think that has a huge impact. If you have a great preceptor, you're going to do great. You're going to learn. Put those two things together. If you have somebody who's not up to the job, I'm not sure how, that may not be as effective, obviously. So we're going to be doing a preceptor program. We're in the middle of planning a virtual preceptor program. Upskilling facilitators, more integration again of that pre-work and post-work, and then we're going to do basically a test. We call them assessments, aka tests, on the whole program's learning and seeing how they do, and what the rate of successful rate of passing. Finally, these two issues on our evals, I'm talking about the 3 months, came up constantly. COVID. They couldn't get in to see patients. It was very difficult to see patients. Coming into the branch, they really wanted to go into the branch and do part of their orientation in there. COVID was very challenging, and IT issues. I can't get into my computer. It's not loading. I can't get all that kind of stuff. I don't need to go on any further on that one, right? Finally, we are at the end of my presentation, and I'm hoping I have achieved what I spoke to you earlier about, that you have learned through exploring virtual training, development, design strategy, looking at challenges, looking at best practices, that you are walking away with tools or ideas or actual, anything that you're going to be able to apply back onto the job. And as I started with a quote, I want to end with a quote, because I do believe what John F. Kennedy is saying. If you think about our nurses that are at the bedside, they are truly leaders, because they are not only learning, but they're sharing their learning to impact our patients' quality of life, ability to manage their disease, to be safe in doing self-administration, self-infusion. So they are leaders. And when you look at all of us, we contribute to their learning. The operations leaders, nurse managers, people who have the actual job as training and educator, we also are leaders, because we are role models for our staff, and we are, hopefully engaging them that they want to continue on that path of continual learning. So with that, I'm going to turn it back over to Jen. I'm sorry I went over by 2 minutes, but trust me, I could have went over a lot longer than that. And I really enjoyed my time, and I really appreciate all of you, participating in the polls and the chats and things like that.
That was some great information, Judy. We do have one question that I'll read out here, which I think is a perfect way to end the session. What is your number one lesson you learned?
Okay. The number one lesson. Oh, that's a hard question. There's just so many. I think my lesson is, I was one of those, organizations. We really did not. We did webinars. So webinars are more like that, informing people. I think my greatest learning was about the value of virtual learning, and we can make it work in ways that you never even anticipated. Is that, oh no, this cannot be, it has to be an instructor-led training, like that preceptor program. I did it about 1.5 years ago. I loved it. Oh man, people love this program. I'm like, that cannot be, there has to be an ILT. We can't do virtual. Guess what? We're going to make it virtual, and we're going to make it great. And so I think that's my greatest learning, that, you can do it, and you can really help your learners to really love it also, and be successful in learning using virtual.
Great. Thank you very much. Many thanks again to McKesson for their generous sponsorship, and for Judy for sharing her knowledge with us. As a quick reminder, in order to get CE, please follow the link in the follow-up email to take a short quiz within 24 hours. On deck for the COVID education series is the emerging use of telehealth and virtual work environments in home and specialty infusion next Thursday from 12 to 1. Please register at NHIA.org. This session is full of information about the positive changes of virtual work environment and telehealth and home infusion, led by a panel of home infusion experts. Thank you to all our providers and suppliers who are working on the front lines to keep patients safely in their home. We are looking forward to bringing you more education each week for our NHIA COVID series. Have a great day.
Bye, everyone. Thank you.